Hey guys, Avi here from Hamilton Physio and Rehab and Precision Physiotherapy. Today I'm going to talk all things but knee pain. So knee pain could be supremely frustrating and annoying, and one of the things that leads for the annoyance is to not exactly know what's causing my knee pain or to find out which structure is at real fault. So today I'm going to try and declutter things and help you guys classify or ask simple questions to yourself to know what could be the real reason for your knee pain. So first question is to know if it is because of an injury or if it is because of just gradual, slowly it started and then progressively have got worse, or it has just stayed the same and it hasn't gone away. So because if it's an injury, then there are few different structures that could be at fault and where you're feeling that discomfort, and if it's a non-trauma, then there is a different classification. Second question that I often ask a patient or would always want to know, where exactly are you feeling this knee pain? So if you could just pinpoint it. Now not everyone would be able to do that. Sometimes for some people it'd be like, it's just deep in the knee, very vague, I don't even know where exactly I feel it, or it keeps switching. Sometimes I feel it here, sometimes I'd feel it deep in the knee or side of the knee there. So that's the second classification. I'll be able to tell you more, but once, if at all, you're able to pinpoint where am I feeling this knee pain and what exact activity is exacerbating it, or that makes that knee pain worse, or it reminds you about that knee pain, then here is some important information for you. So now knee pain could be on the top of the knee pain, or kneecap and bottom part of the kneecap here. Second thing, knee pain could be over the side of the knee, and then it could be tender to touch, or it could be the outside part of the knee. Now outside could be two types, where it is outside and back, and then outside or front, or exactly onto the side of the knee. And another type of knee pain is where you feel the knee pain just actually underneath the kneecap, and then you feel it on both sides. So if you're able to pinpoint where is your pain, then I have some important information for you. So let's start with the top part of the knee, or even the bottom of the kneecap, just onto that straight line tendon. When you touch it, it's tender. It could be because of this quadriceps muscle. So we call this as a patellar tendinitis or a quadriceps tendinitis. All what it means is, so basically all the knee muscle are two joint muscle. They start from the hip and attaches to the knee. So they pass two joints. That means it passes the hip joint and it passes the knee. So your problem may not be in the knee, though you're feeling the problem in the knee. Your problem could be coming up from your hip area. So that could be looked at. But when this muscle is super short, then it puts a lot of strain on the knee and could cause a lot of discomfort in the top or up in the lower part. And this is when you may feel this pain with walking or running, or doing certain exercises in the gym, and then you experience that discomfort. Second problem could be which is very, very common, is inside part of the knee. Now if it's because of an injury, then you'd want to know which exact structure. It could be a ligament, that is MCL ligament, or it could be a meniscus problem. Now meniscus is inside and outside, so it could be the inside meniscus that is it's got either sprained or irritated. Super common after arthritis, and if at all you've been diagnosed with osteoarthritis, then you may experience that pain over to the inside part of the knee as well. And another common thing is bursitis. So bursitis is like a soft fluid-filled sac-like structure with a toothpaste-like consistency. If it has got inflamed or irritated due to a variety of different causes, and if it is annoyed at you, then it may cause a lot of discomfort. It may lead to some swelling there as well. It's super tender to touch. And one of the common complaints with bursitis, what people say, is that I wasn't even doing anything. I was just sleeping and resting, and then suddenly this knee pain wanted to come on. So that could be taking us towards this bursitis problem. Now, another problem is this kneecap pain. If it's underneath, it could be a patellofemoral pain syndrome. Now, I don't want to throw out all these medical terminologies to you, but basically what it means is it's a mechanical problem in the knee. Very, very specifically, people would explain it to be pain, especially while going downstairs, and just stairs being an actual problem, or even in hilly terrains doing hiking on the trails, or with runners. I see that with 12-year-old, 14-year-old gymnasts to 50-year-old moms doing grocery shopping and things like that. So super common for that PFPS problem. Now, if that is a problem, then you definitely want to look at your hip, your foot, your walking pattern, you stand on one leg, your balance, and all that instability could lead to that specific problem. Now, if you are having discomfort over to the side of the knee, now the side of the knee could be because of a band called as an IT band here, which actually goes from the hip and then tapers down to attach to the side of the knee. So if that's tight or irritated, it could pull on the kneecap and could cause a lot of discomfort over the side. Most people explain that pain with straightening of the knee, or coming from a squat position, and then they would say that that hurts, or sitting on a chair or sofa for a long period of time and then standing up from that position could lead to that knee pain, and could be a problem. IT band could actually cause problem in the side of the hip as well, but that's a separate story altogether. Another common problem with the side of the knee, if it is at the back or behind of the knee, then you're experiencing pain while bending the knee. It could be your hamstring which is at a fault. So one of the tendon here, if that's inflamed, that could lead to a problem. If you move your hand and you find a little bit of a bump there and it is tender to touch, and if it is swollen and sometimes warm as well at times, then it could be a Baker's cyst. A lot of you must have seen that in your ultrasound report, saying that, oh, you got a cyst in your back, back of the knee, or something on those lines. Then it could be that problem. Once you're able to declutter with all these many problems that I talked about and find out the real structure at fault or the real cause of that knee pain, half job is done, because now we'd be able to attribute the right solution towards the right problem. So in my next video, I'm going to teach you guys 3 simple tests that you can do to help get even more information about what's exactly wrong with your knee, and to know that if this knee pain is really bad for it to pay attention to, or if it is something that could easily be resolved on your own. Until next time, hopefully this was helpful. Take care.